Well, we are entering yet another holiday season where hospitals are struggling with sick patients.
COVID infections are still a concern, but so are rising cases of flu and RSV.
UW Health Chief Quality Officer Dr. Jeff Pothof is here for his weekly visit. Good to see you again.
Good to see you too. Hi, Dr. Pothof.
So how can you tell the difference between the flu and the COVID and RSV?
I wish there was an easy answer, but there isn't. Even for doctors in the emergency department, there's enough overlap in symptoms between these different viruses that it's really hard to know. Now, the good news is oftentimes you don't need to know. It's good to know if you've got COVID or not. There's different therapeutics that can be helpful, but then whether or not you have influenza or RSV or parainfluenza or rhinovirus or enterovirus, there's so many of them, it doesn't matter because we treat them all relatively the same. You stay hydrated, you take Tylenol and ibuprofen for your fevers, and then you get better. So people don't need to think that they need to go out and get tested to know the name of the virus, especially with COVID testing being easy to do at home.
Is this year's flu shot a good match for this year's strains?
There is more data coming in now that we're seeing more flu cases, and it does look to be a very good match. So at least we got that going for us because we got pretty much nothing else going for us as it comes to flu right now.
Well, I guess the problem being the hospitals are almost full now with people with other ailments and maybe procedures they put off during the pandemic.
Yeah, I think for lots of different reasons, hospitals are full, and it's certainly not, full of people with COVID-19. It's just normal medical conditions that hospitals take care of. So if we were to see, reasonable volume of patients with influenza or maybe COVID later. We saw this with RSV a couple weeks ago with our children's hospital. It can put some strain on the health system that maybe we wouldn't necessarily experience in winters prior.
What is the situation locally right now for flu and RSV hospitalizations and COVID too?
Yeah, I think as far as hospitalizations, RSV is still up there, although RSV cases have started to come down a little bit. They're still way higher than we would expect for this time of year. Influenza, not too bad yet. A couple cases of admission, but at the same time, we'd expect to see those later this week, next week, because that would coincide with about 10 to 14 days after we saw our peak. And COVID-19, pretty steady as far as number of people in the hospital with that right now.
With all this infection this early in the season, might there be light at the end of the season? January, February?
So these are the two scenarios that we don't know what will happen because the whole respiratory season has been messed up. So there's two theories. One, we have a big wave of RSV now. Maybe we see influenza right now, but they taper down, and by January maybe there's not that much. Or they could taper up like they are right now, really high levels, and then just plateau through the whole winter. Obviously, we'd prefer scenario number one, but we're going to have to wait to see how it turns out.
Pfizer is asking to allow its bivalent COVID booster to be approved for kids 5 and under. What would your advice be for people who have questions about the COVID booster?
Yeah, I think, the way the vaccines have played out, and they've been with us for a long time now, any risk that a vaccine has is so much lower than the risk of actually having COVID-19 that we do encourage parents, even parents of young kids, to get their kids vaccinated. This latest move by Pfizer really kind of just updates that vaccine series for these young kids. It's always been a 3-dose series compared to 2 like we have for adults. It used to just be 3 doses of the same original vaccine. What they're suggesting is 2 doses of the original one. 3rd dose ends up being that bivalent booster, which almost brings it in line with what we've getting as adults.
Okay.
Get vaccinated, stay home if you're sick.
Yeah, for sure.
Doctor, thanks for being with us.
Thank you. Appreciate
See you next week.